Hello, this is Karen Burkholder, Karen Burkholder Insurance Agency. Today I'm going to talk to you a little bit about making Medicare simple. Today what we're going to cover is basics, what are supplements, what's prescription drug coverage, and important dates and more. First, we need to know who's eligible. At age 65, you're eligible to receive Parts A and you can turn Part B on, even if you're still working. You may be eligible for Medicare through your spouse, and if you've been married for at least 10 years, and if you have worked at least 40 quarters, which is 10 years, you will be eligible. You may also qualify for Medicare Parts A and B if you're under 65 and you have a disability. First, you need to know when you're going to receive your card. If you're already receiving your Social Security benefits, your Part A and Part B red, white, and blue card will be mailed to you automatically. If not, you will need to apply. And at that point, they'll turn the Part A on, and then you'll let them know if you want the Part B turned on as well. You must have both Parts A and Part B to qualify for any additional help. So when is this time frame available? 3 months before, the month of, and 3 months after your 65th birthday, or within 63 days of when you are no longer on a group health insurance plan. If you are on a group health insurance health plan and you choose to turn the Part A and B on and start receiving your Medicare benefits, then if your group has fewer than 50 employees, Medicare will pay first, your group health plan will pay second. If your group has more than 50 employees within that group, then it will pay first, Medicare will pay second. So you do not need the Medicare Supplemental Plan or the Medicare Advantage Plan. That's all you will need if you're still on your group plan. But if you're no longer on a group plan, that's when you need me to help navigate through the maze to figure out what's best for you in your current situation. So 3 months before, the month of, and 3 months after your 65th birthday is when you're eligible to sign up. And your Medicare supplement, you're eligible the month you're 65, and it goes for 6 months after your birthday for the Medicare supplemental plans with no underwriting. At any point after you have your Part A and Part B turned on, you may apply for a Medicare supplemental policy, but there will be underwriting if it doesn't fall within this time frame. So what are the parts of Medicare? Let's start with the maze of Part A. Part A is what you've been paying for all those years you've been working. If you've worked at least 40 quarters or 10 years, you have already prepaid for your Part A benefit for your Medicare. And that covers inpatient hospitalization, skilled nursing facility, hospice, and some home health care services. You'll turn the Part B on when you're ready to start receiving your Medicare benefits. And Part B covers your doctor visits, certain tests, flu shots, anything within the scope of what normally would happen within a doctor's office or outpatient clinic. Part C is a combination of A and B, where Medicare is paying a private insurance carrier to manage your health care. And prescription drug plan is Part D. So those are the 4 parts to Medicare. What does Medicare cost? Your Part A, if you have not worked your full 40 quarters or at least 10 years during your working years, if you've worked that, there's no charge. If you have not worked at least that much, there's a $471 per month charge to add Medicare Part A. Part B premium is $148.50. Oops, let me go back. If you've made less than $88,000 or jointly less than $176,000. Medicare Original Part A and B only covers 80% of your health care. If you want to make sure that you are not hit with surprise amount of bills, you need to add an additional coverage. So Medicare's only, so let's look at this. If you're in the hospital for 60 days, you're going to pay $1,484. If you're in beyond 60 days, $371 each day, or an additional $10,000, basically $11,000. You have a 60 lifetime day reserve, and you're going to owe $742 each day. That's an additional $45,000 for the total of 150 days. If you're in more than that, you're responsible. So let's see what we can do to help you. Medicare Part B, annually, the deductible is $203 this year. Medicare pays $80, you pay the other $20. If a doctor doesn't accept assignment, you can pay as much as 15%. So which way do you go? Medicare Supplemental Plan or Medicare Advantage Plan to help cover the remaining 20%? It all depends on you. And for full disclosure, because we're supposed to do this now, I get paid the same either way. If you choose to go Advantage route or you choose to go Medicare Supplemental and the drug, my commission is the same. So I'm going to do what's right for you, the client, and you decide which way you want to go. So with the Medicare Part A and B, you must add the drug plan and the Medicare supplemental side. The Medicare Part D drug plan will be built in your Medicare Part C, the Advantage plan. So let's look at a supplemental plan. It's private insurance. They're going to cover the 20%. When you go to the doctor or hospital, you show them your red, white, and blue card, and you show them your Medicare supplemental card. And once the deductible is paid, the Medicare supplemental plan will cover everything else as long as you've been making your premium payments. So here's a quick chart to show you. So here's an example. The Plan G pays 100% of medical expenses after the deductible, which is $203. You pay your Part D premium. So average 120, Part D premium. So your deductible, so that's your monthly charges. Plan F is no longer available if you turn 65 after January 1st, 2020. So you have your Plan G, and Plan G with one carrier is the same as Plan G with another. It's apples to apples comparison. As we show here. So one carrier in your zip code can charge 158 or 264, and another one charge 105. It just depends on the carrier. And you see here for the Medicare Part D standalone insurance plan, you can do it one of two ways. Standalone with your Medicare supplemental plan, or you can have it within your Advantage plan. It's up to you. Now here's a caveat for the prescription drug plan. No matter whether you're on your prescription drug plan or it's built within within your Advantage plan, there is what we have known as the donut hole. So there's 4 stages of your drug plan. There's the deductible phase, the initial coverage phase, which once you and the carrier have paid a total of $4,130 in 2021, then you enter what they call the coverage gap phase or the donut hole phase, which then you pay 25% of the cost of the brand and generic, and the carrier pays the remaining, and then you go into the catastrophic phase once you reach $6,550, where you and the carrier have paid that much together. Then it's the catastrophic, and you will pay approximately 5% of each of the drugs. So now let's talk about the Advantage plans. This is not a comparison of apples to apples. This is going to be apples to oranges to grapefruit to broccoli, and it just depends on the carrier on what they're offering within each of those plans. Most Advantage plans, they don't have a premium, so the only premium you will be paying is your Part B premium. So you won't be paying your Part D premium because it's built within your Advantage plan system. But every time you do go to the doctor, hospital, get a service, you will be making co-payments. And there will be co-insurance, and there will be still the yearly deductible. So this is where you have the Part A and B is turned over to Part C, and then that also includes the drug. Primary care physicians range from 0 to 25, specialists 20 to 40. I have seen a couple at 45. Emergency rooms 90 to 120. Hospitals stays, I've seen as much as $325 a day for the first 6 days, and then it's 0 for days for the remaining days up to 90. But once you hit your deductible, or your max out of pocket rather, once you hit that, the carrier will pick up the remaining number of days. So the Part D prescription drug is included. The only thing you'll be paying is the copays for each of the tiers of the Part D drugs. So here's some differences as you see that there's, like I said, apples to oranges to pears. Some will have better benefits with dental. Some may actually have up to $2,000 in dental, but it must be an in-network dentist. The max out-of-pocket is going to be different. Some are HMOs, some are PPOs. The HMO is more of a managed care system where your primary care physician acts more like an internist, where he is your primary source of care, and he directs the other specialist on what to do. So he has to give a referral for this specialist to come in and to see you and to be paid. And so the primary care physician is your primary source, and they are the first line of defense to keep you healthy. So here's some frequently asked questions. Should you trigger your Medicare if you're still working? That's up to you. We went over that in the beginning. So if you're paying your Part B premium and you're paying your Medicare, you're paying your group health plan premium, you do not need additional coverage as long as there's drug plan built within your group plan coverage. So that's all you need are those two. If your group plan, if you're paying more than some of the numbers we showed you here, maybe you would rather go ahead and trigger your Medicare supplemental plan. Turn your Part B on, get a Medicare supplemental plan and your Medicare prescription drug card. So that may end up being cheaper than what you're paying in your group plan. It just depends. It depends on you. It's up to you to choose what is the best way for you to handle your health insurance after you turn 65. If you choose just to stay on Part A and B, then your choice is to pay the 20% and not have an additional coverage. That's up to you. If you want to add a private carrier, a private insurance carrier, to make sure that you have most of that 20% covered, I can help you with that. Like I said, which way you go is up to you. You can contact me, 469-425-3220, Karen at KarenBurkholder.com. You can go to my website, KarenBurkholder.com, and book a time with me, and we can plug your medications in, plug in the name of your doctors. We can look and see what your options are. So all this is all up to you. And I appreciate you taking the time today to watch this video presentation. I know your time is the most valuable time, and I appreciate you taking the time to listen. I hope you have a blessed day.